Good day, I am Katrina S. Cota from BSED Mathematics 1C. Today, I'm going to discuss all about the anxiety disorders. So what is anxiety disorders? Anxiety disorders are a group of mental disorders characterized by significant feelings of anxiety and fear. Anxiety is a worry about future events, while fear is a reaction to current events. These feelings may cause physical symptoms such as increased heart rate and shakiness. There are several anxiety disorders, including generalized anxiety disorder, specific phobia, social anxiety disorder, separation anxiety disorder, agoraphobia, panic disorder, and selective mutism. So later on, I am going to discuss deeper all about the several anxiety disorders. The disorder differs by what results in the symptoms. The cause of anxiety disorders is thought to be a combination of genetic and environmental factors. Risk factors include a history of a child abuse, family history of mental disorders, and poverty. Anxiety disorders often occur with other mental disorders, particularly major depressive disorder, personality disorder, and substance use disorder. To be diagnosed, symptoms typically need to be present for at least 6 months, be more than what would be expected for the situation, and decrease a person's ability to function in their daily life. So now, let's talk about the several anxiety disorders. So number 1, it's the generalized anxiety disorder. So generalized anxiety disorder is a common disorder characterized by long-lasting anxiety, which is not focused on any one object or situation. Those suffering from generalized anxiety disorder experience non-specific persistent fear and worry and become overly concerned with everyday matters. Generalized anxiety disorder is characterized by chronic excessive worry accompanied by 3 or more of the following symptoms: restlessness, fatigue, concentration, problems, irritability, muscle tension, and sleep disturbance. Generalized anxiety disorder is the most common anxiety disorder to affect older adults. Number 2, specific phobias. The single largest category of anxiety disorders is that of specific phobias, which includes all cases in which fear and anxiety are triggered by a specific stimulus or situation. Sufferers typically anticipate terrifying consequences from encountering the object of their fear, which can be anything from an animal to a location to a bodily fluid to a particular situation. Common phobias are flying, blood, water, highway driving, and tunnels. So when people are exposed to their phobia, they may experience trembling, shortness of breath, or rapid heartbeat. Number 3, the social anxiety disorder. Social anxiety disorder, also known as social phobia, it describes an intense fear and avoidance of negative public scrutiny, public embarrassment, humiliation, or social interaction. This fear can be specific to particular social situations, such as public speaking, or more typically is experienced in most or all social interactions. Number 4, separation anxiety disorder. Separation anxiety disorder is the feeling of excessive and inappropriate levels of anxiety over being separated from a person or place. Separation anxiety is a normal part of development in babies or children, and it is only when this feeling is excessive or inappropriate that it can be considered a disorder. 5. Agoraphobia. Agoraphobia is the specific anxiety about being in a place or situation where escape is difficult or embarrassing or where help may be unavailable. Agoraphobia is strongly linked with panic disorder and is often precipitated by the fear of having a panic attack. A common manifestation involves needing to be in constant view of a door or other escape route. In addition to the fears themselves, the term agoraphobia is often used to refer to avoidance behaviors that sufferers often develop. Number 6. Panic disorder. With panic disorder, a person has brief attacks of intense terror and apprehension, often marked by trembling, shaking, confusion, dizziness, nausea, and/or difficulty breathing. These panic attacks, defined by the APA as a fear of discomfort that abruptly arises and peaks in less than 10 minutes, can last for several hours. So, to help prevent an attack, one can avoid the trigger. This can mean avoiding places, people, types of behaviors, or certain situations that have been known to cause of panic attack. This being said that not all attacks can be prevented. The last but not the least is the selective mutism. Selective mutism is a disorder in which a person who is normally capable of speech does not speak in specific situations or to specific people. Selective mutism usually coexists with shyness or social anxiety. People with selective mutism stay silent even when the consequences of their silence include shame, social ostracism, or even punishment. That's all the several anxiety disorders. So next, let's talk about the causes of the anxiety disorders. Anxiety and depression can be caused by alcohol abuse, which in most cases improves with prolonged abstinence. Even moderate, sustained that alcohol use may increase anxiety levels in some individuals. Caffeine, alcohol, and benzodiazepine dependence can worsen or cause anxiety and panic attacks. Medical conditions of anxiety disorder. Occasionally, an anxiety disorder may be a side effect of an underlying endocrine disease that causes nervous system hyperactivity, such as pheochromocytoma or hyperthyroidism. They have also been known to be associated with certain respiratory disorders like chronic obstructive pulmonary disease. Anxiety disorders can arise in response to life stresses such as financial worries or even mga academic worries, family problems, chronic physical illness, social interaction, ethnicity, and body image, particularly among young adults. Anxiety and mental stress in midlife are risk factors for dementia and cardiovascular diseases during aging. A large amount of stress can be related to any epidemics or pandemic that are occurring in the world. Like for example, in 2019, the coronavirus disease 2019 pandemic was very stressful for those who already suffered from an underlying medical condition. Anxiety disorders are often severe chronic conditions which can be present from an early age or begin suddenly after a triggering event. They are prone to flare up at times of high stress and are frequently accompanied by physiological symptoms such as headache, sweating, muscle spasms, tachycardia, palpitations, and hypertension, which in some cases lead to fatigue. In casual discourse, the words anxiety and fear are often used interchangeably. In clinical usage, they have distinct meanings. So, as anxiety is defined as an unpleasant emotional state for which the cause is either not readily identified or perceived to be uncontrollable or unavoidable, whereas fear is an emotional and physiological response to a recognized external threat. For a huge amount of people, anxiety is a normal response to everyday stress. It's a normal emotion that everyone goes through at a certain point in their lives. Many people feel anxious or nervous when facing problems at school or work, etc. So, kasagaran na niyo maka-experience kay even mga students in their academic. Anxiety disorder, however, are super different. They can cause such distress that interferes with a person's ability to live a normal life. Bitaw kasagaran kay a lot of people feel anxious or having anxiety lead to in committing suicide. So that's not the best decision na dapat. If you are feeling anxious, you should not committing suicide. Kabalo ka sa imong kaugalingon na you feel anxious or naa na kay anxiety, do not afraid to share it to your friends, to your family, because they are really a big help. Matabangan kanila ana through your journey. Anxiety is wala siya cure, dili siya curable, but naa siya treatment para lamang ma-lessen ang imong anxiety. So that's all for today. Thank you for listening.